Hi, everyone. I'm Amy Morgan. I am the marketing coordinator for Pediatric Dental Associates and Orthodontics. And today we are going to have another PDAO team talk. And I am excited to have our special guest, Miss Hannah. Hannah, say hi to everyone.
Hello.
So Hannah has been with PDAO for 7 years. She is a registered dental assistant and has many other duties in the office that she takes care of. And so today we're just going to kind of pick her brain about different things about working at PDAO, some patient experiences, and all kinds of fun stuff, just so you can get to know her, but also get to know our practice through her. So, hi, Hannah.
Hi.
So excited about this. We were talking earlier about how one time we tried to do this in just a treatment room with an iPhone, and here we are. Look how far we've come.
It worked.
It did work. It did work. Okay, so first I just want to talk about a little bit about you being an employee at PDAO.
Okay.
So just what's your overall experience been? Like, what do you kind of wish people knew about this kind of thing, like outside of our practice?
We are treated very well. It's, not your typical in and day out, you're just treated like a normal employee. There's recognition, rewards. We have, a little reward system where we can turn in these points for gift cards of wherever we want. And I think that's really the most important thing with us is, our doctors, they recognize everybody for their hard work and patient care for sure.
Yeah, I love that. And that is something that I kind of have a little bit of a control over, and it is something that we have needed for a long time. We introduced it a few years ago as far as like a point system, but it's also, our practice is a larger practice. We do have a lot of employees. We have approximately 100 employees, and it can be hard to nail down to get a owner doctor to know who the newest employee is and those kinds of things, and being able to try to continue to recognize. So a lot of our recognition comes from within, like other employees saying stuff, owner doctors, associate doctors, like all that. They're always saying, hey, can you give so-and-so some points? Can you do this? They did this. They're leaving me notes. I have Post-it notes all over my desk. It's like, don't forget to put these in, We also, in that program, when you volunteer, you get extra points for doing events and stuff. And we pay our volunteers for them to be able to go and do these off-hour events. But on top of that, you get to earn points. And we also started doing that as the birthday thing as well, meaning that you get a certain amount of points for every employee gets a birthday gift. And so you can pick out whatever gift card it is that you want. Amazon, Ulta, wherever you're wanting to shop. And we also have some local ones as well. We definitely had to have Seven Brew. Shout out. If you need a sponsor, you just let us know, whatever. But it's also just nice from my perspective to hear someone say that off the top. So as far as like your experience as working, I know you work generally with one specific doctor, Dr. Garrett Sanders. He is one of our owners. He's a pediatric dentist. He's wonderful, usually in the Bentonville location, and that's your home office. So talk a little bit about that dynamic and how that relationship has grown.
So I started 7 years ago, but I became his assistant in 2020. So, we lived through the whole COVID time and not too close that point, this social distance type thing. But I mean, he's almost like a best friend. I can confide in him if I have an issue. If he has an issue, he comes to me. I feel like we work really well together for the patients. And he truly cares. And that's the best thing for me. Even if we get into a little tiff, we can talk it out and work it out, and it's just fine.
Yeah, I love that. So does working specifically, we work with 10 providers, usually 9 on average for the dental side, and then we have an orthodontist. So just that experience of working with a group of providers and having to kind of learn different techniques or learn their preferences necessarily. I think we all have a really good goal in mind, like the end goal and like where we kind of place what we're going to do with that. But everybody does have their own individual preferences. And so working in a practice like ours, that can be difficult to navigate for some people. So can you kind of touch base on that?
It can. I mean, in reality, a dental procedure is a dental procedure. They're pretty straightforward and across the board. It comes to, different materials like that, or when you're doing an exam and you don't know which doctor you're going to grab, you just kind of pick up on certain things that they like. And over time, you remember. And even if you don't, they're great. They don't, they're like, oh, I actually wanted this. They are not picky as far as, if something doesn't go quite right. And that's across the board. That's everybody. I feel like I've worked with pretty much all of them and at some point, and they're just the kindest, most understanding group of doctors I've ever worked for.
Right. And that's what I try to, when I'm talking to other employees or whatever, like it's difficult to get those preferences down. Yeah. But in reality, like nobody's going to throw an instrument at you. Nobody, there's not, there are talks around the dental world that happens. But and my only experience in the dental world is PDAO. I've been PDAO forever. And so just being able to hear other girls that have come in from other practices and things like that, and be able to see that we do have good provider-employee relationships and that those are developed over time. I think for sure, like especially in the treatment area, those assistants do get really close to their individual provider sometimes. Right. But there's also this big like team effort of, I know we have like inter-office messaging and it's always like, can you bring me this? Can you bring me that? And it's so nice like that those get answered so quickly. Yes. I mean, sometimes it's an instrument, sometimes it's a blanket, but you just, and all of that is because everyone there is trying to make the patient experience as comfortable as possible. Yes. And that includes not having to leave the room for something or providing a blanket because it's cold, because we're all running around and we need air. Yes. Okay. But again, I think that all just speaks to the type of practice that we are overall. Yeah. From ownership to associates to employees, that from the top down, there is just this genuine concern about patient comfort, making sure we're doing the right thing by the child. And even though that may not be visible to the parent or to the patient, all the stuff that's going around in the background, all the prep that you guys do to get ready for an appointment. Like we're prepping 2 and 3 days before to make sure we have everything. So when you show up, it's all good, that we've got the schedule laid out like it should, so that when we're seeing this child, that we're doing it in the order that we need to. So I think we do a really good job of those kinds of things, but those are like the hidden things and the invisible things that the parent and the patient honestly shouldn't have to worry about, right? Like they should be able to walk in and know that we're prepared. Yes. But it is something that on the backside that we do stress with our employees, is to make sure that on top of everything, good patient care, customer service. Absolutely. And part of that is being prepared. Yep. And part of that is having a good relationship with your provider so that you can work together nicely and it looks like a friendship versus a doctor-employee relationship. Yeah. So, and I have watched yours and Dr. Garrett's like relationship grow and things like that. And I've talked to you a little bit about this, is just watching your dedication and you buying into the whole PDAO mission and things like that. I know a couple weeks ago, you even made a video on your own about summer splash pads. So you can check out our stuff for that. Yes. But it was just really encouraging to see an employee step up and say, I think this is an important subject. I'm just going to take it and do it, partly because, I'm busy and there's 9,000 things I have to do. But at the same time, it was also, it got the content done. It looks great. And so being able to, for me as the marketing coordinator, being able to have that type of relationship with an employee is very nice and comforting as well. So it's just nice to have someone come on the team, be here a while, and be able to get those relationships built. And that is what I try to stress to a lot of employees is once you're here, like you just got to give it a minute, and then it just settles in and everybody gets along. So let's talk a little bit about coworkers. Okay. I know we obviously all have most people have a friendship style coworker that maybe they hang out with after work and there's different things in your private life because you made that friend at work. And I know you have several people in that category. But talk a little bit about those relationships from the new employee coming on and how handling that, but then also how those friendships develop because you do spend so much time together every day. Yeah.
So for our office, I train the new employees, so I get firsthand on, getting to the opportunity to get to know them and train them. And then I feel like once I've done that, I like to check on them. It can be overwhelming. We see a lot of patients. It's fast paced. And our system is a little bit of a pain sometimes. So, I just like to check in, and to them, then they get comfortable with me. So then they can come to me and ask questions. And then from there, it's kind of like, well, how old are you? Where'd you grow up? Where'd you go to school? And it kind of builds from there for sure. I do have some besties, I'd like to call them, at work. Yeah.
You can shout them out if you want to. It's okay.
No.
I'm just kidding.
I'm just going to shout out everybody.
That's right. Right.
But I mean, we don't have the same personalities most likely, but we get along great. We talk after work. We'll text. If we see a meme or something on Facebook, we send it. We've gone to concerts together or the farmers markets on Saturdays. Just having an outside relationship is also pretty cool.
Yeah, I love that.
To hang out with.
I love it so much. So in terms of, you've talked a little about like working there, reward system, ownership, all those kinds of things. One of the other things that we do as an employee group is we always have like a family. We try to have a family day.
Yes.
We try to then we have an employee appreciation day. We try to do small gifts throughout the year. So talk a little bit about your experience with that. And like, I know I always tell you every year, you always send me a text message and say thank you. And so I know that you're appreciative of those things.
Yes.
But can you talk about kind of what that means and what that does for you as an employee?
Yeah. So the family fun night, I have a 6, almost 7-year-old daughter, and she loves my work and she loves Dr. Garrett, and she says she wants to be a dentist, and that's great. So anytime she can get involved in something and be included, she's thrilled to be able to come be at mommy's work. But being able to hang out with, other employees, the doctors, our families in a super relaxed situation, it's relieving, and it's also rewarding because I get to see and meet everybody's families that we normally don't get to see on a normal basis. And then the employee appreciation, we'll go to the opposite spectrum of that. No kids, where we can just all hang out at a relaxed level, but without the children being around it's awesome. We get, I get to see people that I don't normally see that work in Fayetteville, and vice versa. So it's a cool way to just join together and have a super fun, appreciative time.
Yes, I love that. So I guess that's another thing you kind of touched on it is we do have 2 locations.
Yes.
And it can be hard for team members to get to know each other.
Yes.
And the locations are run just a little bit differently. There's a few tweaks in each location that by volume just makes sense for each practice in each location. And so sometimes people can get overwhelmed with that or even disappointed in that.
Right.
And can you talk a little bit about how you navigate that? Because you do work in Fayetteville at least one day a month.
Yes.
And so talk a little bit about that, how you've kind of navigated that. And
I mean, when we go down there, I go to the room I'm normally in, but everybody, they greet me, good morning, or you're here. I'm like, yes, here today. So it's pretty open and welcoming, even though I think a lot of them don't necessarily know a lot about me. Just they may know who I am or who I work for. But, their volume down there, it's almost hard when I'm only going down there once a month to get to know people on a different level. But, it's always good morning. How are you? Can I do anything for you? It's different, but it works.
It does work.
Yeah.
And that's more of the point I was trying to get to is that it does work. It's not excellent all the time. And it's not, we all obviously as a practice, I always say we can get 1% better every single day. And that's kind of my thing, that all things that are implemented or recommended or suggested or employees come to me with ideas, it's all because they care about PDAO.
Right.
And so for me, as long as it's coming from that place, like I will always look into it. I will always, do what I can to make something happen. But I think in general, like, it's interesting to sit, especially in my position, kind of being on the leadership team and working more direct with all ownership.
Yes.
I see that in that leadership room with them, and a lot of employees don't get that opportunity.
Right.
And so it's kind of nice to hear somebody like understand that it is working on the outside of that room. And,
it does.
We're trying our best.
Yes.
And then I guess just from a patient and parent perspective, what is it like? Are you developing some relationships with some of these parents and patients, meaning like they remember you when they come back? And I know you're not in hygiene, so it's a little bit different that you're not seeing them every 6 months, but you're in the treatment room where all the bad / hard stuff is happening.
Yes.
And but at the end of the day, we're just trying to create a healthy mouth for these children in the most comfortable way possible.
Yes.
So I don't know if you have a patient story you want to share, or if you just want to talk in general about kind of what that looks like for you and kind of how what your approach is for that.
So I do some cleanings, there was one particular patient. He had never done well before. Mom was like, oh my gosh, you got him to lay down. So then he requested to see me every time. He ended up needing some treatment. So then again, came back to my room and we were doing some different things. He might have struggled a little bit, but we made it through. And the mom was just like, I can't believe you even got him to lay down after 2-3 years of not being able to do anything. And we continued the relationship for a couple years after that, and then they moved away. But it's stuck with me, being able to at least help him get through the easy stuff. And then we had to get through some hard things too.
I think when I ask employees in like private surveys, like what's the best experience you've had with patients? And some of them have specific stories.
Yes.
But I would say majority of them are, I got a patient to do something they did not want to do the last time they were here, or the last 2 or 3 times they were here.
Right.
And, dentistry is an awkward situation. Like people are always like you said earlier, it's dentistry.
Yeah.
It's, nobody goes, I love going to the dentist.
Yes.
Well, I love getting my teeth clean, but just saying. So we're also like, these are young children that like don't really understand. Like, you want me to lay down to have my teeth brushed? What are you talking about?
Right.
So I think that as an employee, from the employee perspective, that joy that we get, it's, I want employees to be able to hold on to that. Like you said, you remembered that. And it's, I just think it's important. I had a very brief stint of being a dental assistant. We won't go into that story. We've always all laughed about it, but it was a very short stint. And I still remember some of those kids. I still remember names. I mean, they're in college and have babies now, but it's because either I've become friends with their parents somehow just through, whatever. But I think about it all the time. I think about sitting there with Dr. Jerry and like, just really learning how to do everything. And there in the early days, like it was a lot different. We had to work with every single provider, and it was just interesting. But I still remember specific patient-parent interactions that brought me joy.
Right.
And I think that is also part of my advantage, that I had that, and it gave me a different perspective when I did move over to the admin team. So I love that.
Yes.
Let's see, what else do you? So I guess in terms of just PDAO as a whole, we have been in the area for 26 years now. Dr. Tanya Triplett started the practice on her own in 1999, and it has grown and grown and grown and grown from a 1-doctor practice to now 10. We do have a very large patient database, and you would just assume that most people in Northwest Arkansas would know who we are, where we are, that you should come here, like those kinds of things. But what I want to know is, from your perspective, is like, what do you wish maybe parents that aren't seeing us yet, or they're not bringing their kids to us yet, and they haven't found a dental home, like, what do you wish parents knew about PDAO for their kids that they aren't just going to get from a social media post or something?
Sure. So I have always thought the ortho-pedo combination was a cool concept. Personally, I've seen Dr. Jason collaborate with one of the other dentists on a specific patient. So you're not just getting, one perspective, you can have multiples. So even if one dentist is like, I'm not sure, let me collab with somebody else, you can get multiple decisions and, options based on your specific child. And I think that's important because you could go to one particular person, and not that that one's wrong, but if you have something complicated, you at least have the option to have different minds on it. And I love that Dr. Jason will, communicate with the dentists on what to do when we have to take part of something, and vice versa. They go to Dr. Jason and say, hey, I need you to look at this. And he's like, super open to, yeah, let me check that out. Or, hey, can you check that out for me? Type thing. They work really well together. And I think that's the dynamic that sets us apart.
Yeah. And that collaboration is something that I've tried to work hard on getting it to be public facing. Yeah. But it is hard if you're not already to understand it, if you're not already in it.
Right.
Because we see them in the office looking at other, this patient has a cavity, but I've got a bracket on there. Do we need to move it? Those kinds of things. And I always say we have a ton of wonderful providers in Northwest Arkansas. We have great general dentists. We have great pediatric dentists. We have great orthodontists. And we want you to be comfortable with your dental home. Right. And you have to choose what is right for your family and what works. But one thing about us is that collaborative care and that being able to have your dental and your ortho in one place.
Yes.
Your records all in one place. If you're seeing an orthodontist in a private practice and you have a cavity or something they want to look at, you may have to go and see the orthodontist, have the wires and the brackets taken out, come to your general dentist and have the cavity fixed and then go back to the orthodontist. I mean, that could take a whole day.
Yeah.
Right.
Yep.
Whereas with us, we can send you over to the ortho side, have everything taken off, get your treatment done and go back all on the same day.
Right.
And so that is something that I really wish more people understood. That's how it's working, but it is really hard to show that on video.
Right.
I can take a photo of Dr. Jason and Dr. Garrett standing there looking at an x-ray together, but it's not telling the right story. I can even think of Dr. Bree, she's always, even dentist to dentist, not orthodontist to dentist, but even dentist to dentist.
Yes.
All of the dental providers are collaborating with each other. Oh, would you cap this? Would you fill it? Do they need to have it extracted? Do you think an abscess is starting here? Everybody's collaborative education and experience together is huge. I really need to do the math with how much experience we have amongst just the providers. And I guarantee you it's over 100. It has to be. So 100 years worth of experience in one building.
Yes.
It's huge.
Yeah.
So I need to do the math on that. So.
For sure.
Is there anything else that you want to share? Is there whether it's about working there, whether it's about what we do, anything else you want parents to know?
I think sometimes our volume can be intimidating to parents. But as an employee, I truly think we give exceptional care across the board. And so even though, yes, we see a lot of patients and we have a lot of employees, we all have the same common goal, which is to, create a positive experience at the dentist. Some of the anxiety and stuff starts when kids are young as far as getting their teeth clean. So if we can help change that, that's what I strive and want people to know the most.
Yeah, I think you hit it right on the head. I mean, the volume, Bentonville is a smaller office. Yes. So it's still high volume in terms of other offices, but Fayetteville definitely has that volume where they are seeing a lot of patients. And I agree with you. Some people think it's intimidating, or maybe it's, it may not be the right fit for your child. It literally may not be, but with that volume, it doesn't negate the quality of care. For us, in PDAO, you have to go fast. The child's attention span is nil. And that is why a lot of especially the hygiene appointments, they're fast. Like the actual thing, because we're well trained.
Yes.
We can do all the things we need to do in a short amount of time, because we do want to be able to hold their attention, and at least at minimum get them to understand how important it is to take care of their mouth.
Right.
And then we try to educate the parent on, here's how you can do this at home to keep this up. And in all honesty, if you were to time it and like things like that, like those specific things don't take that long.
Right.
And so I know there's families that come in, are like, we love it. We get in and out. Everything's good. Everything, all of that.
Yes.
And, we do have some families that it's not right because of, their family dynamic or how it's whatever. And we understand that. And we want you to find the right provider for you and your family.
Yes.
But we also want you to understand that the volume is because we're seeing pediatric patients and we're trying to hold their attention span. Like it literally, it does work itself out. Again, you're scheduled for a certain time point. And if something happens with your kid and your time goes over the appointment time, we're not going to stop and say, well, you're over your appointment time.
Right.
Like we would never do that.
No.
So I know on our like holds message, it always talks about something called kids time, where we just kind of promise that like, if for some reason we're running a little bit behind for your family's appointment, like it's because there's another child that's having a difficult situation and we're trying to work them through that.
Right.
And we promise the same for your family.
Right.
If your family is scheduled for an hour to be there and they're there an hour and a half, we're getting it done. We're not saying, well, we don't have time for that or we don't, And so again, it's that behind the scenes thing that we know is working.
Right.
So I think you brought up a very valid point, and I appreciate that.
Yes.
Okay. So we have reached the rapid fire portion of this video. Okay. So I have a few questions I'm going to ask. She has kind of heard a list, but she doesn't know what I'm going to ask for sure. So off the cuff, we just need to know. Coffee or energy drink?
Coffee.
I knew that answer. Okay.
Someone might tell you different, but
there you go. What songs get you hyped on the way to work?
Oh, man. I listen to a lot of 2000s alternative.
I mean, we're okay with that. I love that. Whatever gets
it's
you
usually
hyped.
my go-to.
Yeah. Always arriving at the office early. Hannah is an early arriver and she just settles in, gets everything done. But like, she's definitely an early arriver and has her music blasting sometimes. What color is your current toothbrush?
Pink.
Ooh, pink.
Shocking.
I know, not black. Okay. What is your go-to lunch on a busy clinic day?
The gas station across
the street. Yes, our Bentonville location is located between a McDonald's and a gas station that has a deli. So we could go either way sometimes. All right. What is your dental superpower? I know the answer, or what I would say, but what?
Wait, like if I had a
you had a dental superpower. So examples are the calm whisperer, the sticker queen, retainer finder.
Oh, I don't know.
You're Mrs. Fix-It.
Oh, okay, yeah.
She's totally the tech girl. She fixes equipment all the time, and it's amazing. So you're like you're the maintenance girl, sort of. I'm going to say tech girl sounds better for a superpower.
Maintenance. Maintenance sounds weird.
Maintenance. Yeah, no. Okay, what is your favorite age group to treat in the office?
Ooh, 4 to 7.
4 to 7. That's our wheelhouse too. That's what we do well with that age. I love that. I say I love that a lot. So it's going to be all.
They have the funniest things to say.
The kids do say the darndest things. I know. It's crazy. I can't wait to interview. There's another employee who has a hilarious story about Dr. Jerry, and I can't wait to share that one. So stay tuned for that. I'll let you know when the Dr. Jerry story is included. What is one thing you never leave home without?
Other than my phone?
I would say, yeah.
My phone? My hand lotion.
Hand lotion.
It's in my purse.
Yeah, dry hands. We wash our hands a lot.
All the time.
Okay. All right. Is there anything else that you want to share or?
I don't think so. Okay. I love my job.
Yes.
I love what I do.
Yes, we are very lucky. So again, this is Miss Hannah. She is an RDA at PDAO, has been with us for 7 years, coming up soon. And we are very, very thankful and grateful for her. We hope you've enjoyed this interview, got to know a little bit more about Miss Hannah. So thank you for joining us.
You're welcome. Anytime.
Yes. So I'm Amy Morgan, and if you have any questions or concerns, whether it's teeth related, employee related, I'm happy to answer those questions. All you have to do is email me at amy@smilesarewild.com. And if you're watching the very end of this and you're like, hey, I really need to make my kid a dental appointment, our office number is 479-582-0600. Or you can go directly to our website at smilesarewild.com and click schedule an appointment. Thank you all for watching.